The previous post, Electronic Health Records, Who Do We Build This For?, suggests that EHRs have a number of users and stakeholders, and that there is tension in figuring out which ones to focus on and what metrics to gauge success. I've become increasingly convinced that a key hypothesis and metric to gauge success in building enterprise EHRs is that we can build an electronic health record tool that clinicians eagerly want to use over their paper-based workflows. So, why is this the right assumption to test? We can build an electronic health record tool that clinicians eagerly want to use over their paper-based workflows. Why is measuring the conversion of clinicians presented with the option of retaining their paper-based workflows versus switching to the EHR one of the right metrics to track? Well, adopting principles from the lean startup, such an assumption could both partially test the value hypothesis, that we can build something users want, and the growth hypothesis. Widespread word-of-mouth adoption is possible. And from my experience on both sides of the Atlantic, introducing electronic health records into new clinical environments is like pulling teeth. Most people dislike change in the workplace in general, and it makes sense that changing the tools people use to see patients from analog to digital would induce discomfort among any staff. The problem is compounded because many EHR tools are very poorly designed to operate smoothly at the point of care, such as during the clinical appointment. And so this means that clinician workflows are often affected for the worst, as new electronic health record tools make their work more cumbersome and difficult. It is no surprise that when presented with the opportunity, many clinicians are hesitant to make the switch. And in many contexts, the only reason clinicians do switch is that their administration forced or told them that they had to. The unwillingness of clinicians to willingly switch from paper to digital shows that the widespread global adoption of electronic healthcare records is going to be slowed. And in turn, this slow EHR rollout impedes the ability to bring the benefits of EHRs over paper charts to the care of many patients, such as improved clinical decision support, reminders, access to information. On the other hand, if an EHR tool is well built and clinicians eagerly want to switch to it from paper, this will make scaling point-of-care EHRs faster. Imagine the potential for product growth if clinicians at neighboring facilities and neighboring health regions asked their facility leaders to install the same software and hardware that their colleagues down the street have access to. Or potentially even if patients demanded that their care providers start to adopt the best of these tools because they know that their care experience will be better. This word-of-mouth growth strategy could really work to increase adoption of well-built point-of-care electronic health records. Now, of course, obviously I'm biased. My hope would be that clinicians one day are very eager to install open MRS-powered systems, but you get the point. Now, why do we need to gauge the eagerness about this? The hypothesis notes that clinicians eagerly want to move to the EHR, and the eagerness and long-term satisfaction of the tool is equally important for word-of-mouth growth. My impression today is that clinicians in the US tolerate EHRs, but you'd be hard-pressed to find many who love them. The alternative to using an EHR, having to search for paper charts on the wards, having to decipher ineligible handwriting, having past documentation not available, not having up-to-date labs, these are more frustrating options for many clinicians than the problems posed by typical modern EHR systems. But tolerating a product isn't good enough. No product really has experienced rapid word-of-mouth growth because its users simply tolerate it. Users have to love it if we want to adopt a growth strategy of word-of-mouth adoption. And so satisfaction with a product could be tracked with metrics such as daily usage by clinicians, ongoing user retention among clinicians, and trended net promoter scores from those clinical users. Now, a net promoter score could ask, how likely are you to recommend this tool to your colleagues? And a high score would indicate that the clinicians have the potential to be word-of-mouth evangelists for it. Now, this qualitative metric of user satisfaction can be matched to the more objective metrics of user retention and product usage frequency. But it is helpful to capture both of these metrics at the same time, I think, because perhaps the only reason that clinical users continue to use the app is that they're forced to by their administration. And so in those cases, their user retention and daily usage numbers may be high, but their true user satisfaction remains low. So what's the next steps? Well, what is needed to make an EHR that clinicians eagerly want to switch to from paper? Well, I think that question has many potential hypotheses as far as what could best support it. And I think the next post will discuss the immediate versus the delayed benefits of EHRs. And this might be some areas to focus our initial energy.